A 35-year-old primary gravida came to antenatal clinic at 16 weeks of gestation. She was instructed to perform triple test. This test is used for evaluation of option A hydrops fetalis, option B Down syndrome, option C congenital hypothyroidism, option D phenylketonuria. The answer is option B Down syndrome. Triple test is done between 15 to 20 weeks of pregnancy. If AFP and erythritol are low but HCG is high, it indicates possibility of Down syndrome. Low level of AFP, erythritol and HCG indicate possibility of Edwards syndrome. Next question, which of the following drug of choice for the management of endometriosis? Option A estrogen, option human menopausal gonadotropin, option C danazol, option D dorodine. The answer is option C danazol. Danazol is a class of medication called androgenic hormone used to treat endometriosis by shrinking the displaced tissue of the uterus. Danazol also treats fibrocystic disease by blocking release of hormones that cause the breast pain and lumps. Central government program for the betterment of slum dwellers. Option A Pradhan Mantri Mudra Yojana, option B Valmiki Ambedkar Awas Yojana, option C Pradhan Mantri Madhur Vandana Yojana, option D Deen Dayal Antyodaya Yojana. The answer is option B Valmiki Ambedkar Awas Yojana. Valmiki Ambedkar Awas Yojana was launched by Prime Minister on December 2, 2001 with a view to ameliorating the condition of the urban slum dwellers living below poverty line by providing them with dwelling units and facilitating of community toilets. Deen Dayal Antyodaya Yojana is one of the Government of India scheme for helping poor by providing skill training. Pradhan Mantri Madhur Vandana Yojana, formerly known as Indira Gandhi Matrutva Sahyog Yojana, is a maternity benefit program run by the Government of India. It is a conditional cash transfer scheme for pregnant and lactating women of 19 years of age or above for the first live birth. It provides the partial wage compensation to women for wage loss during childbirth and child care. Next question. Benign ingrowing of endometrium into the myometrium is known as. Benign ingrowing of the endometrium into the myometrium is known as. Option A adenomyosis, option B endometritis, option C endometriosis, option D leiomyoma. The answer is option A adenomyosis. Adenomyosis is a condition which inner lining of the uterus or the endometrium break through the myometrium. Endometritis is an inflammation of the endometrium. Endometriosis is the condition when a tissue similar to the uterus lining tissue grow outside of the uterine cavity. Leiomyoma is also known as fibroid, a benign smooth muscle tumor that very rarely become cancer. They can occur any organ, but the most common form occur in the uterus, small bowel and esophagus. Next question. Active management of third stage of labor include all of the following except. Option A early cord clamping, option B applying suprapubic pressure, option C prophylactic oxytocin after delivery of anterior shoulder, option D controlled contraction. The answer is option B applying suprapubic pressure. The third stage starts from the delivery of fetus to delivery of placenta and membranes. Components of active management of third stage of labor. First is uterine drugs was administered within birth of anterior shoulder. Second is the immediate cord clamping. Third is controlled contraction. And last is the massage the uterus immediately after delivery of placenta and membranes until it fails. A primary gravida in 34 weeks of gestation was admitted in obstetric ICU with severe preeclampsia. She was on magnesium sulfate therapy. The nurse should assess all of the following before administering next dose of magnesium sulfate except. Option A pupillary response, option B respiratory rate, option C urine output, option D deep tendon reflexes. The answer is option A pupillary response. Before administering second dose, monitor the respiratory rate, patellar reflex and urine output. Criteria to continue magnesium sulfate maintenance dose. The respiratory rate is more than or equal to 16 breaths per minute. Patellar reflex is present and urinary output is 30 ml per hour. If the respiratory rate is less than 16 breaths per minute, give antidote calcium gluconate 10% 10 ml in 100 ml of normal saline IV slowly over 10 minutes. If the patellar reflex is absent, withhold the dose. If urine output is less than 30 ml per hour, withhold the magnesium sulfate.